and welcome to the South First, where we narrate the other half of India's story. The number of celebrities dying due to cardiac arrest seem to be adding up. We even saw a viral video of a young man in Bareilly collapsing to death while dancing. Interestingly, most of these cases, what was common that we saw where they were exercising, maybe in the gym or dancing on the stage, etc. So, while one hand we have doctors advising that exercise is important for health, cardiac health especially, so, what is it? Why is it that we are seeing people dying while exercising? So, what is going wrong? To speak on this, and also what are some of the precautions one should take before working out at the gym? What should gym owners and trainers consider as precautionary measures? Today, with us, we have Dr. Abijith Vilas Kulkarni, renowned interventional cardiologist from Apollo Hospitals in Bangalore. Thank you for joining us, Doctor.
Thank you, Chetana. Thanks for this opportunity.
Thank you. So, first of all, we hear statements like, my grandmother had a heart attack, but thankfully she survived and is doing good now. Then we have statements like, my friend who was only 40 years died of cardiac arrest. So, what is this difference between cardiac arrest and heart attack?
Okay. So, heart attack is any phenomena which results in interruption of the blood supply to one portion of the heart. So, we have all heard of blockages. Blockages are a precursor to heart attacks. So, how fast a blockage develops determines whether you can have a heart attack or not. The meaning is aged persons, long-standing diabetes, long-standing hypertension. Basically, most of the diseases that we all have are age-related. The problem happens when these, which are supposed to be age-related and so-called coming at a later age of our life, when they start manifesting at the younger age, then they create a lot of problems. So when a 78 or an 88-year-old has a heart attack, it's acceptable because most of it is age-related. Now, when a 40-year-old has a heart attack, he's not aged so much as to develop so much thing. So a heart attack actually means at some point in time, that blockage has become so much that it has interrupted the blood supply. Interrupted meaning 100%. So that is the definition of heart attack. Now, what transpires through and goes through the overall situation and what determines survival is 2-3 things. How many of the other blockages are there? Whether the patient had any premonitions, whether the patient had other morbidities, already had a minor heart attack in the past, which was not noted, which was not evaluated, and how fast these things happen inside the heart. So now this determines whether the heart attack is going to develop into a cardiac arrest. So a cardiac arrest is where heart attack means interruption of blood supply. Cardiac arrest means stoppage of the heart.
I'll cut you here. I think that is where I want to reach out to what are the things we should really know about. So before we reach there, sir, what explains, see now whenever there's a celebrity death, I know that, there is a round of awareness which is created, which is good. I mean, but then we don't really have to wait till somebody dies to know a lot of things about heart attack or a cardiac arrest, those things. So first of all, what is explaining this spate of, there is definitely an increase. It's not like we cannot brush it under the carpet and say that, no, this is just because celebrities are dying, we are noticing. It's not that. I'm sure there is definitely an increase in the number of people dying due to heart attack, especially in India. So what is this? What explains this, sir? Is it COVID? What is it actually?
Okay. So the thing is, for anything in the science to be proven and evidence to be generated, it takes a lot of time, madam. We need to understand that. First of all, if it has to be scientifically proven, there's a large body of evidence which is required and a longer follow-up that is required that translates into scientific evidence. So it is not very easy with small observations that we make. For example, just to give you an example, if 4 crore people receive vaccination and if 20 die of vaccination, if 20 people die of vaccination, that is not significant enough, right? For to implicate but for that person. So, but as medical professionals, we know that vaccine sometimes it has resulted in increased clots, and for that to translate into active research or active evidence, it will take a lot of time. Now, this is one point. Yes. So the classical known risk factors for heart disease, which have been described for the last was 70, 80 years are the same. The diabetes, hypertension, smoking, sedentary life, increased weight, family history, age, all these are routine risk factors. Now, suddenly increase in all these things can be explained by two, three things. One is the aspirational part of our younger individuals to be everything at a very young age, which possibly is not physiologic. Possibly we are overstretching ourselves and endangering ourselves to these basic diseases that are diabetes and hypertension. If we stress ourselves too much, we don't have enough sleep. If we don't rest ourselves well, I mean, hypertension is a very simple thing that comes out. And if our stress levels are so more and our diet is not good, exercise is not good, the utilization of the sugar by the muscles is not good. That's where exercise comes into the picture. So the sugars are high. Now, these diabetes, hypertension, increased incidence of heart attacks is what we believe as medical professionals.
And we now have a post-COVID world. This holds good for any kind of diseases onset also, I think. So in a post-COVID world, how much of exercise is too much of exercise? And we are looking at various age groups now. So does this hold good across age groups when we are looking at the amount of exercise and the kind of exercises one can do? So if you can touch upon, the cardiac health and exercises.
Yeah. So I think it's a very important and relevant topic. I think we all here in this world, we all would like to be performers in everything, and even at office and this thing. And when it comes to exercise also, so everyone wants to be a performer there also and then showcase his ability. So now exercise is a tricky thing. I mean, a lot of marathons have come. Those Facebook posts that we have finisher and all, they are important, and for one's own self image or whatever you can say, so many things are connected with that thing. So we tend to overdo things, and we have to realize that we all are different in our way of achieving things, and we all in our physical ability and all, and everything requires supervised training. Okay, so you just cannot wake up one day and start thinking that I mean, mental this thing is power is important, but physical ability also has to be in balance. We cannot have a mental superpower and with no physical ability, and with that discordance is there is possibly resulting in all of these problems. The how much we should stretch ourselves is something that we should all know, and rather than having a fixed formula for this, we should all first work up as to what our basic ability is and understand our risk factors when we are enrolling ourselves into some kind of an event or a training program, or you're preparing for some marathon and all. If you have not done anything in the past, then you need to know that what is your basic risk. So whether you are predisposed to all these problems, do some basic testing, like what is your risk level. Unless you know your risk level, you will never know what you are capable of first. So whether you are, because these risk factors will not have any symptoms, so they will manifest as diseases at a very later stage when a lot of time has elapsed. So we need to know our risk whenever we are enrolling, first of all. So whether we are having high cholesterol, sugar, BP. So that is a first checkpoint wherein we understand that these are the things that need to be modified. And that general risk estimation also has to have something like a echo and a treadmill test, which will screen us for some problems which are genetic, like some heart defects, holes, and some muscular problems of the heart called as hypertrophic cardiomyopathy, and also whether there is an asymptomatic heart pumping which is reduced, and also whether there are any problems and what our treadmill shows. Now, if this part is clear, so that is the first step. And that doesn't mean that everything of this machine is normal and the next day you can run a marathon. No. So if the basic machinery is good and the risk factors are not elevated, then you can train yourselves. So that is the this thing, that is the sabak that I would like to give, that your machinery is good. That doesn't mean that you can stretch the machinery the next day. So the next, I mean, you are capable of doing that, but you have to train yourselves. So what is recommended is see, as we age, our machinery is going to, it's like any car. Maybe I can say after till first 5 years, there's no servicing required, but after that, you go to the garage, so frequently. So something like that at 45, 50 years, again the machinery is this thing. Then at that time, if you want to perform and use your mental force so much to show that I can do this much, I can lift so much, I can run so much. I mean, you have to respect your physiology and limit yourselves to a certain level, and not do too much. And meanwhile, also ascertaining whether something is happening inside and be alerted about these symptoms. So the best form of exercise is a combination of too much sports will result in injuries. Too much of cardio sometimes is also not very good in terms of this thing. A good balance of a moderate level activity, aerobic activity in the form of walking, light jogging, and weight training with some sport it's the best combination that we can have, which can be safe. Overdoing one thing might be a little bit difficult and might predispose us to a certain variety of problems. Yes, if you are quite used to doing a certain level of activity for some time, generally your endurance will pick up and then you can slowly go. But suddenly trying to achieve certain things, increasing your intensity to a certain level, so it might not be recommended. That is one part. Second part is you should always be aware of what is happening during all these things, whether you are noting some increased acidity, whether you are noting that on some particular day you are not able to do certain things. When some people have their minds fixed that come what may, I will go to the gym at 7 o'clock in the morning, whether you have not slept, whether you have done anything and all. You don't need to prove anything to anyone. These are things that are to be done for yourselves. So when your machinery is not fit to do that, you have been awake till 3 p.m. 3 a.m. in the night, and you want to go to the gym at 7 o'clock in the morning. That is not done because your machinery is not well to do that. That's being a type A personality, which is also an important risk factor for all these cardiac problems. So we need to understand on each particular day whether I'm okay to start my exercise and to what level I have to go. And if at all that this thing that gives me a green signal, then I go there. And if I'm not feeling well, I'll try to stop today and try to do the same thing the next day when you have slept better, you have a better frame of mind, and physically you are more charged up, whatever. So that is how you need to take. So there is has to be a balance between what your mind will promote it to do and achieve things, and what your physical bodily signs give it to you. There has to be an understanding. The third important part is when you start training, at least I think this is important that our trainers should be aware of basic CPR. Like I said, generally this overstretching of exercise and sudden collapses are because of arrhythmias. That is the electrical fizzy that happens during these problems. Now that is potentially reversible because many a times we see people taking mobile pictures at that time and posting on the media. Rather than that, if we have some persons or some people who are trained to change the outcome there, it can make a huge difference to especially the cardiac thing. So a person who is there then and there, if he is understanding of what has happened and can save the situation and save the patient before this thing. We have such situations now. A lot of patients when these things happen, they are given CPR at home and then they are brought here alive, and then we do the rest of the thing. So the basic CPR training, understanding what happens during that point, what is your role, has to be given to at least these gym trainers, so that if they are coming out as a high risk situations.
So we are coming to the end of it. I would just want to know if you can give us, say, about 5 tips or whatever, some of the important tips to remember about your cardiac health when you're hitting the gym, or when you're even in general. It could be somebody who is not really used to going to the gym, but is just wants to know about some of the tips to remember and some of the symptoms to watch out for.
Yeah, I think even if you are not going to the gym, it's fair. I mean, at least you try to make 8,000 to 10,000 steps per day. If you are able to achieve that, it's a good form of exercise. I mean, going for a walk, dedicated walk is good, but not being sedentary means at least achieving 8,000 to 10,000. That does the same job. So basically, you should not be sedentary. Measure your risk factors after a certain age. We need to know. So you don't need to go to the doctors only when you are sick. You are going there for wellness, basically to understand your risk and modify. If you know, for example, that your cholesterol is a problem at some point in time, then your brain will signal you, yes, I have to keep a track of this, and then this thing. Go for at least, if one annual checkup is completely normal, you can defer the next checkup maybe 2 to 3 years. But at least first time, at least at maybe 35 years or 40 years, you have to undergo that checkup and understand your basic risk, or to what are the things that are problematic. And don't ignore symptoms for sometimes it so happens that you get some burpings, and this is the commonest thing. I had thought that this is acidity or whatever. Thinking is perfectly fine, taking some over the counter antacid is all fine. But I think if it is troubling you and it is not, you just go and take an ECG and take an opinion from some medical person. Let him decide whether this is acidity or no, and whether what we need to do regarding that particular thing. So these are 2 3 important things. Not to be sedentary, measure your basic risk factors, and don't ignore your symptoms. So these are some important things which can help. And don't overstretch yourselves in the try. I mean, I am young, I am fit, and all that. We see young people having all these problems. So nowadays, maybe an immune dysregulation post COVID, and whatever it is. So the exact causes of so many young people is difficult to establish so soon by medical evidence. But meanwhile, we passed through this where more robust data is available. We need to be more careful about this, and then take one thing at a time, and concentrate on the basic rules of modifying our sedentary life, measuring our risk factors in the form of diabetes, hypertension, and cholesterol, quitting smoking, and not being sedentary.
So one last thing, sorry to stretch this. One last thing I wanted to ask you is, is there any specific, like there are some unusual symptoms which are related to heart attack or cardiac arrest. So if you can just give us some of the symptoms which are usual symptoms and some of the unusual symptoms also which we could watch out for.
Okay, many people are now aware that the heart pain comes on the left side and it radiates the arm. So the other thing that we know, we should know, is that it can come to the jaws. It can come in the throat as an irritation or choking sensation in the throat. And heart pain can be there in the epigastrium, that is the upper part of the stomach. And also the pain can be in the shoulders, bilateral shoulders, and the neck. And typically, I mean, it comes as a heaviness over this thing. And whenever it is associated with breathlessness, or it comes on exertion, that is more typical of cardiac thing. Unusual symptoms are sudden giddiness, sudden falls, sudden feeling of tiredness, not able to do anything. So these are the other unusual symptoms. So sometimes it might just manifest as vomiting, and suddenly you have bouts of vomiting. And these are the other things that, apart from that left-sided heaviness and radiating pain to the arms, one needs to be aware of whether this thing. And uncontrolled diabetes, because diabetes causes problems silently without having classical major symptoms of the heart. They will not be having anything. They'll just come with tiredness and very high sugars, and they don't feel anything. At that time, there is a need to evaluate the cardiac function and understand whether any of this is abnormal. Many a times it so happens that they will be noting these symptoms, but they are too scared to come to a hospital or report them, because they feel that so many things are at stake. The finance is at stake, and the fear, the stigma, all of these things are at stake. So, but I think we have to overcome that and have faith in that medical science, wherein which can make a difference to the overall outcome, especially in these patients. And that is what is going to make these barriers to be addressed.
Thank you very much, Dr. Abijith, for your time. It was wonderful talking to you. That is all we have
Thank you,
for
Chetana.
today. Thank you for watching. Thank you, sir.